magazine. This is Dr. Thompson Tuba, the editor of Health and Development magazine, and we are in the Walter Washington Convention Center, downtown Washington, D.C. We are part of the American Academy of Pediatrics Association annual meeting 2015. And with me is Dr. David GITANGA, right?
Yes, that's correct.
Tell me a little bit who you are.
Thank you, Dr. Thompson. It was a pleasure meeting you almost accidentally. I was invited by the American Academy of Pediatrics Executive Officer Jonathan Klein to participate in this National Congress and Exhibition meeting of 2015. And it's such an eye-opener when I came here.
You have been here and you have attended the sessions. You were part of the plenary of this Monday morning. You have also spoken to colleagues from Canada, from Europe, from Asia, from South America, I'm sure also from other African countries. First of all, you happen to be the chairman of the Kenyan Pediatrics Association. How long have you been the chair or head of that organization?
I've been the chair of the president of that association for the last 4 years, and I've been the vice chair for the last 11 years. So I've been at the helm of the Pediatric Association for roughly about 15 years. And within that time, the membership has grown from a small group of pediatricians who started out in 1968 to 400 strong members of professional association spread out across the country, made of pediatricians and other people who are interested in childhood affairs.
Beautiful. Apparently, you're from Kenya,
Yes.
and the president of the United States, though an American, is a Kenyan by father, and we would be very proud to have you here and to know that we are talking to a Kenyan who is attending this meeting. Having said that, I want us to look at some issues. You must have noticed that some people were protesting outside by the convention center in entrance, and also at the Renaissance Hotel and the Marriott Marquis Hotel. They had different posters. They were representing different organizations, and their protest is against circumcision. With your experience, with your leadership as chair of the Pediatric Association of Kenya, what would you say are the positives of those people? And if you think that they should not be there, why shouldn't they be there?
I must say that I was surprised and actually spent a bit of time talking to them to listen to this protestation about male circumcision. And I just wondered about what the world is all about. Where I come from, HIV is a major health problem. And HIV, we know one of the strategies of trying to actually control or keep in check this epidemic is really circumcision, a strategy that has worked fairly well. It doesn't on itself immunize you against getting HIV, but we know it's an important strategy. So when I see that there is opposition to male circumcision, I was a little taken aback, particularly considering the huge numbers of children who are still getting born infected and who we are trying to control, and any measure that actually reduces the transmission of HIV is important. So I thought we live in different worlds. A very important aspect of this conference, listening to many speakers, is how equity and access to health impacts on communities. And it's amazing that we don't think about children, and children, we say, are an important resource. They are the leaders of tomorrow, and if we do not do things that get children to survive into the future, then basically economies will not function. So I am interested in areas of access to health, particularly poverty. Poverty seems to surround all disease aspects of children, particularly in our part of the world. And poverty is material as well as mental. Mental poverty by leaders who are not thinking in the long term, who have short-term benefits, and who see children as basically consumers of service rather than an important resource for work and so forth. Very interesting to listen to toxic stress, issues that happen to children that impact on their lives totally in the future. And these are definitely important issues that I'll be bringing up to my members to also let them know that even in this part of the world that we view as being sophisticated, they are faced with fairly similar issues, and we could learn a lot from them.
There is a lot that is going on, and apparently you would have noticed from the schedule that there were different sessions going on. The military people had a whole session yesterday on what they call uniform services section. The international, or what they call the global child health section, also took place yesterday, and from 8:30 a.m. to almost 5 p.m. you know, there were deliberations, there were discussions, there were talks on global child